Welcome back to A Slice of Health, where health comes alive, with bite-sized health education to keep you moving and become your own health champion, with stories that heal and knowledge that empowers. But before we jump into our topic for today, I want to tell you a story. Jill is a 35-year-old woman whose grandmother has been diagnosed with Alzheimer's. Jill's grandmother first started showing signs of change in memory, forgetfulness, and occasional accidents happening in the house around the kitchen, forgetting to pick up dry cleaning, doing multiple rounds of grocery shopping, forgetting that she already had 2 crates of egg in the kitchen when she was in her 50s. Some people started thinking that this was the quirky side of Jill's grandmother. Jill's mother actually started playing and joking around, saying her mother was losing her marbles when she was in her 50s. Jill recalls her grandmother calling her twice on one particular day and having the exact same conversation with her. That was when Jill knew that something was wrong. That was when Jill was only 20 years old. Now at 35, 15 years later, Jill's grandmother has received a diagnosis of Alzheimer's. Jill is quite concerned. Her grandmother was always a sharp and astute woman who knew everyone's names, everyone's details, and never forgot anything about anyone, whether it was their favorite color, how they liked their cupcakes, their favorite kind of pie. Jill's grandmother, she always thought, would be as sharp as she was on the very first day she called her grandmama. As Jill watches her grandmother's decline, forgetfulness, not being able to recognize her or her mother or her husband, Jill wants to know, is this going to happen to her mother as well? Is this going to happen to her? Is this something that runs in families? And should she avoid having children if this might happen to them? So, what exactly is Alzheimer's disease? What do we know about it? And how should we best answer Jill's question? Alzheimer's disease is the most common cause of dementia. Dementia, as we know, is a general term that means different kinds of illnesses that can affect our brain's function relating to mood, behavior, personality, ability to think, and reason in a way that we would usually expect. Dementia is not something that occurs from birth. It's actually something that tends to occur, describing a mental decline as opposed to one that was developmental. Now, Alzheimer's is the leading cause of dementia. There are different kinds of dementias. What we know is that about 1 in 3 people over the age of 85 have dementia. However, 1 in 10 around the age of 65 have dementia. Signs and symptoms of dementia are like that of Jill's grandmother when she was younger, such as changes in memory, difficulty in coordination, mood changes, problems processing language like speech, changes in behavior and mood, and also sometimes a decline in ability to reason. Reasoning including things like mathematical reasoning, processing of information as well. Memory loss, however, is one of the most common signs and symptoms of Alzheimer's. This includes the difficulty with remembering things in the short term or long term. Long-term things could be issues like the names of your children, the dates that you got married, events in the past, events in history, occasionally forgetting things like your occupation. Short-term memory also then affects things that happen on a daily basis, like forgetting you have 2 crates of egg in the kitchen, but going to buy some more, forgetting that you turned on the kettle, forgetting that you have something on the fire. Now, Alzheimer's disease, being the most common cause of dementia, is a disease that happens when there's a build-up of certain kinds of proteins in the brain that can cause Alzheimer's. These two proteins are called amyloid and tau. Now, because the brain has lots of different nerve cells around the body, these proteins can stick together onto our brain cells and cause Alzheimer's disease. Unfortunately, there is no specific cure for Alzheimer's disease. Management of Alzheimer's disease can sometimes help to reduce the progression of disease and reduce the symptoms as well. Other managements of Alzheimer's disease include providing support so that the person who lives with Alzheimer's can live as independently as possible in their home by making care available so that they can do day-to-day basic tasks from muscle memory while having people around that can help them with safety and any other reasoning activities that might be required. However, this is dependent on the stage of the disease, as some people with Alzheimer's disease might need to be fully dependent on someone else for day-to-day functioning. Now, Jill's question about Alzheimer's disease being hereditary is an important question. Alzheimer's disease can be genetic. It can be inherited. The risk of it is about 1 to 3 times if you have a parent or sibling with it. This means that Jill's mother has a 10 to 30% likelihood of developing Alzheimer's disease if her mother has it. But other than the genetic risk factors, what other risk factors do we have? Risk factors include race, in certain situations being of Afro-Caribbean descent or of being Latino descent. Also having had an experience of having traumatic injury to the brain. Smoking is also implicated. There's also some factors relating to our physical health that can have an impact on the risk of developing Alzheimer's, such as cardiovascular disease, so diseases relating to the heart and vessels. Diabetes, high blood sugar, is increasingly implicated in a lot of dementia. People who have had a diagnosis of something called Down syndrome, which is a developmental condition related to genetic factors. High blood pressure, high cholesterol, and obesity are all also implicated. Now, as we mentioned, in certain situations, some people with Alzheimer's disease can live with support, and some people would need significant help on a daily basis. Complications, in addition to the loss of ability to be independent, include increased risk of infections, potentially seizures. In people who don't have really good care that helps them move around, get out of bed, they might be predisposed to having bed sores. Tooth decay and dental issues are also quite common in those living with Alzheimer's disease as well. So how does Alzheimer's disease become diagnosed? The first thing is loved ones are often the first people who notice that something is wrong. Sometimes it might be a coworker or a neighbor. They might notice changes in mood. They might notice inability to complete daily tasks and routines. The main investigations are a brain MRI and tests that assess cognitive function. This includes asking people questions and assessing their ability to recall these questions as well. As we mentioned, some tablets can help slow down how fast the disease progresses. Other things that can be done are sometimes to help manage any associated symptoms. These can be antidepressants or anti-anxiety medication that can sometimes help with restlessness and changes in mood. Other things like anti-seizure medication can sometimes also help in managing seizures and changes in mood as well. Now, prevention of Alzheimer's, which is what Jill wants to know, includes the basic things that we normally mention. However, it's important to know that there are some risk factors that cannot be changed. We've referred to these on previous episodes as non-modifiable risk factors. Things you can't really change, like your genetics, the family you were born into, exposure to certain environmental factors in the past or in the future. But things that she can do to reduce her metabolic risk factors are eating a healthy diet, getting lots of physical activity, staying mentally active, and staying socially connected definitely help to keep the brain engaged and healthy. So for Jill, what we would let her know is to make sure that her mother, if she ever develops any of the signs or symptoms of Alzheimer's disease, has a conversation with her doctor to get an early diagnosis and to start getting support and treatment. Genetic conditions can be complicated, and seeing a loved one lost to a condition that we cannot see physically is also really debilitating. So support in form of therapy or group support is also really helpful to help Jill and the rest of her family cope with this diagnosis that her grandmother has received. So that's it for me from today. Until I'm back in your ear tomorrow with stories that heal and knowledge that empowers. Bye for now.